Katie Miller shares her experiences with VABVI Children Services. Fade into an exterior shot of the Vermont Association for the Blind and Visually Impaired offices in Berlin, Vermont. In the scene that follows, Katie Miller is a mother with brown hair and glasses, wearing a blue shirt, and is illuminated by a window above her right shoulder.
My name is Katie Miller, and my husband Stephen and I have a daughter, Maggie, who is 1.5 years old. And when Maggie was born, she came out with a full head of white hair and was a really big surprise and was diagnosed at birth with albinism, which means that Maggie doesn't produce pigment in her skin or her hair or her retina. So part of Maggie's visual impairment is that she doesn't have pigment in her retina. She has photophobia, so she's very sensitive to bright light. She has nystagmus, where her eyes shake back and forth. She also has strabismus. And then on top of that, how her vision works, it's been explained to us. I wish all the time that I could see the way she sees so that I knew exactly what she can see or how she sees. But the way it's been explained to us is it's like a picture that's low resolution. So instead of it being a TV where the image is super crisp, it's like somebody reduce the resolution and it's a lot of really big pixels, so it's really fuzzy. On top of all that, she can also have just normal vision related stuff that she could wear glasses for, and her the things with her vision aren't correctable with surgery or glasses typically. And so we found out at birth that Maggie's range of sight would be, her acuity would be anywhere from 2400 to 2040 best case scenario corrected vision. And it was a huge shock. My husband and I are both artists. And, you know, when you're pregnant, you don't have any vision for the future other than what's considered quote unquote normal. And it was a big adjustment for us in terms of how we thought about her future. But the truth is that Maggie is just like any other kid. She just sees differently. And a huge part of us working with her and her vision and learning about her and her vision has been our work with Vermont Association for the Blind and Visually Impaired. Right after birth, we got hooked into services through early intervention with our pediatrician. And right around 3 or 4 months, TVI started coming to our house once a month to meet with us. And it was like, when she walked through the door the first time, it was like having a new person join our family. She just made us feel so comfortable and helped us as new parents wrap our minds around what it meant to have a child with low vision and how we could best help Maggie learn and engage with her environment and adapt to her environment. And honestly, I don't know where we would be without that TBI. When she came, especially in the beginning, there will always be unknowns. We can't predict the future. But when there were so many unknowns and we had so many questions, it was so helpful to have someone who had worked with many, many, many other children that, while she couldn't predict the future either, could give us a little bit more of an idea of what to expect. I think as a parent of a child with a disability, all we really want is for Maggie to be able to learn and grow and engage with her environment to the best of her ability. And I really honestly believe that we would not be where we are with her without her TVI and the community connections we've made through other parents with disabilities. And some of those we got hooked into by our TVI, which was really amazing. And I think in the future too, knowing that the TVI is going to follow her through her development and help us with things. Now we have an 18-month-old that's walking and climbing. And as you can imagine, an 18-month-old with low vision brings some added complications. So what things do we need to do to our environment, or childcare need to do to their environment to make it more navigable for her? And that's all things the TBI has helped us with that I would have no idea how to do on my own. So I'm excited also for the future to have that support.
Scene fades out to a photograph of the Berlin office of the Vermont Association for the Blind and Visually Impaired. Text appears. For more information about VABVI Children's Services, please call 1-800-639-5861 or visit us at www.vabvi.org.